Go.
So, good afternoon, sir. So, today I am going to perform the Musculoskeletal System or the MSK system. So, for the preparation, I will assemble all the equipments needed and supplies. Reflex hammer if available. Goniometer also if available. For goniometer, it's measure the angle of joints. And also, I'm gonna use tape measure to measure the muscle deviation. Next, I will explain the procedure to the client and wash my hands. So, sir, in this procedure, I am going to check if there is any abnormalities. So, first, I am going to do the inspection of gait. Gait is a manner of running, walking, or stepping. So, I'm gonna let the patient walk and observe the swinging of arm, the balance, and the posture. Um, so, the gait of patient is normal. He has a support of base and the swinging of our arm and normal posture. So next, I will assess for the falling backward with older or handicapped client by performing the nudge test to the patient. So sir, please stand. So far, the nudge test result is normal. So next, sir, I am going to inspect and palpate your temporomandibular joint or the TMJ. So the TMJ is a small joint located in front of your ear where the skull and the lower jaw meet. So I will going to inspect and palpate your TMJ. Then I will test for the range of motion. So sir, can you open and close your mouth? Close, open. So sir, can you move your jaw laterally, side to side? So next is I am going to inspect and palpate your sternoclavicular joint. It's a joint between the sternum and your clavicle. So I will inspect the sternoclavicular joint for the location in midline, color, swelling, and masses. So I will going to palpate for the tenderness or pain. So next, I will going to inspect and palpate your cervical, thoracic, and lumbar spine. Then I will observe the cervical, thoracic, and lumbar curves from side to side, then from behind to determine the good posture and note for the abnormalities. So sir, stand. Then next, I am going to palpate spinous process and paravertebral muscles on both sides of spine for tenderness or any pain. So, then I will test for the range of motion in a cervical spine. So, sir, can stand. Then I will test for the range of motion of thoracic. So, then Then I will test for back and leg pain. So next, I will test for the back and leg pain. I will do the Lasigi sign. I will let the patient to raise his leg and do a dorsiflex. Dorsiflex. So next, I will going to measure for leg strength. I will use this tape measure to measure the leg of patient. So sir, can you stand? I will going to inspect and palpate for shoulder, arm, and elbow of patient. So first, I will going to inspect and palpate the shoulder and arm. Then I will inspect the elbows for size, shape, deformities, redness, or swelling. So next, I am going to test for the range of motion of arms, shoulder, and elbow of patient. So perform a range of motion. So next, I will going to inspect and palpate the wrist of patient. So first, I am going to inspect the wrist to note for the size, shape, symmetry, color, and swelling. Next, I will going to palpate for tenderness and nodules. Next, I will going to palpate the anatomic snuff box. A snuff box is a hollow area on the back of the wrist at the base and fully extended in the thumb. Here. Palpate. So next, I will going to test for the range of motion in the wrist of patient. So sir, follow my. So next, I will going to test for carpal tunnel syndrome and note if the patient any feel tingling or any numbness. If tap this so. So, sir, do you feel any tingling or numbness? So, the next test is I will going to test for the Fallon's test, which is the patient flexing his wrist. So, I will let the wrist of patient flex in 60 seconds. So assume that it is done in 60 seconds. And note for any abnormalities or positive in carpal tunnel syndrome. So next, I will going to inspect and palpate for hands and fingers. So first, I will going to inspect the size, shape, symmetry, and swelling, and also the odor. Then, I will going to palpate the fingers from distal and proximal, and also I going to note for the tenderness, swelling, bony prominences, nodules or crepitus of each interphalangeal joint. Then I will going to assess the metacarpal phalangeal of joints. So next, I will going to palpate each metacarpal of the hand, noting for tenderness and swelling. Then I will going to test for the range of motion. So next, I will going to inspect and palpate for hips. First, I will going to inspect the symmetry and shape of hips and going to palpate for stability, tenderness, and crepitus. Then I will going to test for the range of motion. Then I will going to test for the range of motion of the hips. So next, I will going to test for the range of motion of the hips. So start. So next, I will going to inspect and palpate for knees. So first, I will going to inspect for size, shape, symmetry, swelling, deformities, and alignment. Then I will observe for quadricep muscle atrophy. Then next, I will going to palpate for tenderness, warm, consistency, and nodules. So next, I will going to test for swelling, which is the bulge test, to detect a amount of fluid in the knee joint. Then next, I will going to perform the Baluthman test. I will grasp my thumb in the thigh above the knee. Then I will tap the patella with my left hand, rebound fluid percent. So next, I will going to test for the range of motion of the knees of patient. Very good. So next, I will going to test for pain and injury. I will going to do the McMurray test. The patient is in the supine position, and I will note for the rotate, note pain, and clicking. So, sir, do you feel any pain? Any distraction while we are performing? Okay. So next, or the last procedure in the musculoskeletal system of patient, I am going to inspect and palpate the ankles and feet of patient. First, I will going to inspect for the position, alignment, shape, and skin. Then next, I will going to palpate the ankles and feet for tenderness, heat, swelling, and nodules. Next, I will going to test for the range of motion. So sir, I am done now with the musculoskeletal system procedure or examination in the patient. So the findings of patient is all normal. There is no any deformities, swelling or nodules, or any abnormalities found in his musculoskeletal system. Thank you.